You recently had an abnormal Pap smear. A Pap smear is the first step in a series of tests that we use to help prevent you from ever getting cervical cancer. A Pap smear screens for abnormal cells from the surface of your cervix and tests for the human papillomavirus, or HPV. We look for HPV because we know that it causes most cervical cancers. 8 out of 10 people get HPV in their lifetime. However, your body's immune system works for you and often can clear human papillomavirus on its own. But sometimes HPV can stick around and cause the cells in your cervix to become abnormal, precancerous, or even over time cancerous. When we find abnormal cells, or HPV, we often need to follow up with a colposcopy. Colposcopy is a procedure where we use a microscope to get a closer look at your cervix to look for any signs that HPV may be causing your cells to become abnormal or precancerous. We often use different types of liquids to make abnormal cells appear more obvious. If we see areas that look like they might be affected by HPV, we will take a small biopsy or pinch of tissue. This may cause cramping or discomfort. You may have some spotting. You should be able to continue your day normally. When we get your cervical biopsy results back, we typically have 2 possible outcomes. Often we find normal cells or only mildly abnormal cells. In these cases, we can plan to watch your cervix with more frequent Pap smears. These mild abnormalities may become normal with time. If we find more severely abnormal cells, we need to meet to discuss a possible treatment to remove these cells to prevent them from developing into cancer. In addition to your annual exam and screening, there is one other very important thing that you can do to protect yourself from cervical cancer. Get the HPV vaccine to prevent cancer. The HPV vaccine is best when given to boys and girls at age 11 to 12, up to age 26. It is recommended for men and women up to age 45. What's next? It's time to schedule your colposcopy. We will get a clear picture of what's happening in your body and do what's needed to keep you healthy. Ask your provider about your personal cervical cancer screening and prevention plan. Remember, with regular screening, follow-up, and treatment if needed, we can prevent cancer.